Well, good afternoon, everyone. My name is Dr. Robert Richard, and I'm a bariatric surgeon at the Longstreet Clinic Center for Weight Management. First and foremost, we'd like to thank you for tuning in to our Facebook Live session today. We're here to talk to you about our various options for weight loss and how our team is working hard to accommodate the needs of our patients and making weight loss an option for today and not something we put off till tomorrow. I'm here with Dr. Miguel Del Mato, bariatric surgeon at Longstreet Clinic, who's been practicing with us for over 7 years and who has well over 10 years of experience in bariatric surgery. I'm also here with Dr. Eric Velasquez, our newest bariatric surgeon. And although very new to our practice, he has well over 10 years of bariatric surgery experience, and we are very happy to have him join our team. And I'm also here with a special guest, Stephanie Glauer, who is a patient of ours. She's a teacher who had weight loss surgery last fall, and we certainly will enjoy hearing her story. For those of you who are unfamiliar with our practice, the Longstreet Clinic Center for Weight Management is a medical practice made up of a team of providers that focuses 100% of our efforts on weight loss and weight management. That means that all day, every day, we are helping to guide our patients down their personal path to weight loss. We do this in many ways. We offer medical weight loss services, nutritional counseling with our certified dietitian, meal replacements and supplements, as well as surgical weight loss. We're here today to talk to you about all of our services and to introduce Dr. Velasquez and to hear from Stephanie. So first, Dr. Velasquez, please take a minute to introduce yourself to our audience today.
Absolutely, and thank you for having me, Dr. Richard, and thanks for everyone watching the Facebook Live. My name is Eric Velasquez. I'm a bariatric surgeon. I'm originally from Santo Domingo, Dominican Republic. I did my general surgery residency and bariatric fellowship in New York State. After training, I practiced in North Carolina. I've been in practice for a little over 10 years, and I recently relocated from Philadelphia, where I had the role of Chief of Bariatric Surgery at Temple University.
So, Dr. Velasquez, tell us a little bit about your background and why you decided to specialize in bariatric surgery.
So, I wanted to be a doctor since I was little. My dad is a retired surgeon, and I always wanted to do what my dad practiced. Through residency, I developed the love for minimal invasive surgery. Is the field and bariatrics, which is the field of surgery that combines technology with complex abdominal surgery. Bariatrics in a specific has the advantage that it creates that long-term relationship with the patients. And we rarely see that in any other surgical specialty. So that was my passion for bariatrics and why I decided to pursue that fellowship.
I think we all face that, and we definitely love that about our practice. I can tell you when I first looked at your resume, or CV as we'd say in medicine, I was really impressed at your background, and I knew that you were going to be one of the more sought after surgeons in the United States. So what made you finally decide to come practice with us at Longstreet Clinic?
Well, that's a twofold, I would say. So first and foremost, my years of practice in North Carolina made me fall in love with the South. I met my wife in North Carolina, and even when we decided that we were moving to PA, we knew that at some point we would return to the South. So when I started looking for opportunities, I found the opportunity with Longstreet Clinic. As I look into it, I found that you guys were there, and the reputation of Dr. Richard and Dr. Del Mato is well known within the bariatric community. Also, Longstreet Clinic has a very well-known reputation for being an environment of a lot of camaraderie among physicians. So immediately I knew I wanted to be part of that.
Well, that's great. We certainly feel blessed to have you have joined our practice. So what should new patients know about you?
Well, I think what I would want new patients to know is that I understand what they're going through. I understand what they're trying to achieve, and I'm here to help them become that healthier version of themselves and to finally win that battle against obesity.
I totally agree. So, aside from medicine, tell us a little bit about yourself outside of the office.
So I love the outdoors. I have two little boys, a 4-year-old and a 7-month-old. I enjoy taking them out. I'm sorry, my connection kind of blipped there. I enjoy taking them out for a walk. I like mountain biking, and I'm also an avid off-roader. I have a big Jeep that I take out in the off-road.
Well, that's interesting. I hope to be able to enjoy that with you one day. So absolutely, we're a weight loss practice. So Dr. D'Amato, why don't you join us and tell us why weight is important to one's overall health.
Well, thank you for having me on, and thanks to our audience for being here today. Weight is an important part of the numbers that help describe a person's overall health. We know about the vital signs: heart rate, blood pressure, temperature. Those things can point toward disease. Obesity itself is a disease, and going beyond the standard parameters for what someone's weight ought to be starts putting a lot of pressure on all the organ systems: the heart, the lungs, the gut, the kidneys. Everything that you makes up your body is impacted by your weight. And this is a chronic long-term disease that requires specialists, the same way you would go to a heart doctor for a heart problem. And that's what we are here at Bariatric Center at Longstreet. We do a Monday through Sunday job of taking care of people's weight.
You know, patients often come through our doors who've been battling weight for years. Can you talk a little bit about those factors that contribute to someone who's become overweight and who maintains that status long term?
Well, I think it's important to, like Dr. Velasquez said, to understand the journey. The journey is not something that began yesterday or the day before. For most patients, it is a lifelong journey, or at the very least several years long journey before they seek out someone like us. But that long-term care that was going on preoperatively or before meeting us, we need to approach it long-term after meeting us as well. So the factors that play a role, it's not just diet, it's not just exercise. There's genetics, there's family history, there's personal decision-making, there's behavioral health. When we look at a patient, as a mind, body, spirit. All aspects of the patient need to be addressed and taken care of in the care of the obese patient.
I totally agree. So Dr. Velasquez, I know you've got vast experience with bariatric surgery, and you've seen many improvements in your patient's health. Can you kind of describe some of those improvements that we should expect?
Sure. And as Dr. Almazo mentioned, obesity is associated with a lot of comorbidities. Bariatric surgery helps improve and sometimes cure a lot of those comorbidities. We see patients achieve resolution of obstructive sleep apnea and stop needing a CPAP machine within weeks after surgery. We also see patients that get complete resolution of the type 2 diabetes. And notice that I didn't say improvement, I said complete resolution, because that's something that happens with bariatric surgery. Patients actually get cured from type 2 diabetes. We see patients get off medicine for high blood pressure. And another important factor about obesity that a lot of patients don't know about is that when patients are affected by obesity, there's a 52% increased risk of developing cancer, some of the hormone-related cancer. And undergoing bariatric surgery helps achieve a 33% improvement or reduction on the risk of developing those cancers.
Certainly, those are tremendous benefits to weight loss surgery. So now, weight loss surgery is a broad category. So, you know, we do lots of different operations. So Dr. D'Amato, I give you the task of trying to describe what bariatric surgery is. Tell us about bariatric surgery.
So bariatric surgery is the act of operating in the belly to help achieve long-term lasting weight loss with a metabolic impact. So the things Dr. Velasquez was mentioning with the diabetes and the blood pressure, those are metabolic disorders. So the surgeries that we do aren't just aimed at restricting how many calories come into a person, but also help improving their metabolism long-term. And the three surgeries that we do are the gastric bypass, the gastric sleeve, and the duodenal switch. All of these surgeries are done through minimally invasive techniques, which means small little incisions, several throughout the abdomen, and not one long incision. That allows us to have faster recovery times, get people back home sooner, back into their home life sooner, back into the work environment sooner, basically get you back on your feet again. Sometimes we use the advantage of having the robot assist us. Sometimes we do it laparoscopically, how we consider it kind of traditional laparoscopic. But the main key is making smaller amounts of food come in, changing how the body approaches those calories coming in, what the body does with them to improve the metabolism long term.
So I'm a patient and you said sleeve gastrectomy. What exactly does that mean?
So a sleeve gastrectomy, if you can use a little model here, you have the esophagus coming down, the stomach, and then the small bowel going this way, coming along here and cutting out these 3 extra fingers of stomach. And it leaves a smaller stomach that looks almost like the sleeve of a jacket or a sleeve of a shirt. That's where the name comes from.
So I got a small stomach. Will that stomach ever grow back? Does it ever come back? What happens?
So I think the stomach's a very stretchy organ. The same way there's other organs that can stretch, like a uterus. If there's a baby in the uterus, it gets bigger. After delivery, it gets small again. So the stomach is still designed to stretch while it's inside you, even if it's a smaller stomach like a sleeve. But with proper teaching, with proper kind of bariatric etiquette, it's possible to maintain that stomach at a smaller size, or even if it does grow, help it shrink back again to be able to accommodate the amount of food we're looking for a post-op patient.
Okay, so that was one option you mentioned. I'm still that patient. So Dr. Delmato, why would I choose that option over one of the others that you mentioned?
So I'm a big believer that the best surgery for the patient is the one they feel most comfortable with within certain parameters. There's a few certain conditions that are out there that I recommend one or the other, but at the end of the day, most patients are best served by going onto our website, looking over the 3 options, and developing a sense of peace or comfort with one or the other. Because at the end of the day, how much that person is motivated to continue with the bariatric lifestyle long-term really plays a strong role in how well they do long-term. And I think starting by picking the surgery that's right for you with some guidance from the physicians, obviously, is a great first step.
Okay, so you mentioned that gastric bypass. I've kind of heard about that. And, you know, I knew somebody who had a gastric bypass and, you know, that operation, they got in trouble from that operation. What do you say to that patient that gastric bypass causes every ill that patient has ever had?
Well, I certainly think once you intervene in someone's life surgically, there's always going to be that moment where you're their doctor. And I think one thing that we do particularly well at Longstreet that is not necessarily universal across the country, across the world, is support patients long-term. So it's not just enough to have a surgery, because the idea that a surgery fixes someone, I think, is incorrect. I don't think of our patients preoperatively as broken. Their body's doing what it's designed to do, avoid starving to death. It does it better than some and worse than others, but the key thing is, from a surgeon-patient relationship, we want to grow old with our patients. That's the goal. We want to be there when things are getting challenging as you transition from your first year to your second year, from your 5th year to your 10th year. We want to make sure we're following you up. And so if that patient's having challenges with the gastric bypass, it's not you're on your own. You always have a home and a welcoming environment here at Longstreet.
I totally agree. And I certainly think that patients should understand that we would hope that they don't come to us with a preconceived notion of what operation will be best for them. I think our role as physicians are to look at their medical history and to help guide them to an operation that's not only going to get them safe and effective weight loss in the short term, but be a better long-term option for them. That may be the sleeve gastrectomy. It may be the gastric bypass. It certainly may be the duodenal switch. I also like to point out that as expert surgeons, we also do a lot of revisional surgery. We do surgeries for patients who have had other procedures in the past, even the distant past, that may or may not need improvements or may or may not need corrections. So we are certainly a very experienced practice in that regard. So I'm gonna stick with you, Dr. Delmato. Are these safe?
Yes, I think in the hands of an experienced bariatric surgeon, bariatric surgeries are a very safe option. Nationally, the American Society of Metabolic and Bariatric Surgery is kind of our governing body, and their research shows that in the hands of an experienced bariatric surgeon, these are about as safe as a gallbladder surgery, of which about 700,000 gallbladder surgeries happen every year in the country. Our experience, we have almost at this point, I think we're getting close to 50 years combined experience between the three of us. We only operate at centers of excellence. We've done thousands of cases collectively. It's an impressive resume. And we'd love to have anybody come and check us out and meet us, sit down with us. There's a personal connection with bariatric surgery that doesn't always exist in other surgeries. I think we've got three great providers. We've got great staff out front that really just want to do the very best to serve patients.
I definitely agree. And, you know, we're often asked by patients an important question. Will my insurance cover these services? And I can tell you the answer varies, and it can change from year to year. Right now is open enrollment time, so I would encourage you that if you didn't have coverage in the past, to check with your HR department, look at all your options, or if you still don't feel comfortable with that, you can certainly call our office and talk with one of our professionals who will walk you through the different plans that you have available. Just for an example, the Department of Community Health voted to reinstate bariatric surgery coverage to our state health employees benefit plan starting in January. So our school teachers, members of the assembly, retirees, even dependents will have this coverage. So we would hope that you would pick one of the plans, such as a Blue Cross plan, which we're a center of distinction, that would allow you to have this type of a coverage moving forward. So now's a really good time for you to check your benefit package. So for that patient that's sitting out there thinking, I've tried to lose weight before, well, what makes your program any different? Well, I can tell you that there are a lot of things that makes us different. One of the things that makes us different is that we will individualize a treatment plan for you. So you may have seen a physician that gets weight loss with medications. You go see that physician, whether you need medications or not, you're probably going to get it. You may have gone to see a general surgeon in the past who is very comfortable doing sleeve gastrectomies and not so much with the other procedures. So if you're going to go see that surgeon, you're probably going to get a sleeve gastrectomy, whether or not it's the best option for you or not. Our practice is different. If you come to our practice and you've got 5 pounds to lose, you're probably going to see our dietitian. She's probably going to do a body composition analysis for you. She's going to go through a dietary plan for you, and she's going to follow up. If you need 30 or 40 pounds of weight loss, you may see one of our bariatric providers. You may see Dr. Havilana. You may see Altia Morris. You may see Mercedes Hall. They're going to do a body composition evaluation. They're even going to do a medical evaluation. They're going to look at your history. Maybe you were just put on an obesity-genic medication by your primary care physician. They may actually work with your primary care physician to adjust your medications in a way that then we can work with you with a low-calorie diet or very low-calorie diet. If you have 70 to 100 or 300 pounds to lose, you probably see one of our surgeons. And what we will do is do a medical history evaluation, looking at your past surgical history, looking at your medical history, and then recommend what option of surgery we think would best suit you in your specific situation. So I think what sets us apart is that we're an experienced group of providers that provides 100% of our time to bariatric surgery. This isn't just part-time for us. And our practice is 100% focused on weight loss and weight management. And patients certainly move back and forth between our surgery and our medical weight loss practice. And of course, Dr. D'Amato touched upon the fact that we are experienced. We do have a vast experience. I've been doing bariatric surgery since 1998. We have done thousands of procedures between us, and our practice has been around for years. I joined a surgeon here in 2002 who had been doing bariatric surgery for 15 years before me. We're probably one of the only practices in the state that focus just on weight management. So we're a very different practice. And we're innovative. I mean, during COVID-19, we couldn't do operations at the beginning, but we could still see patients. You know, Dr. D'Amato, you were here with me last year. Can you talk a little bit about how we plan to continue using our virtual options for patient care and access?
Yes, sir. COVID-19 obviously was a huge moment in the United States history, but we did not sit idly back and just kind of receive the pandemic. We responded to it as best we could. We recognize there will always be patients that we need to see, we need to serve, and we were able to figure out ways to do that electronically, kind of like we're doing with the Zoom call right now. A lot of the post-operative care that we do for patients is coaching, is counseling, is advising. Even more so than the hour we spend in the operating room, it's the hours we spend with patients long-term. And to be able to connect through telehealth has really been a blessing for us, for our patients, to let us keep serving even in the middle of the pandemic when things looked really bad. And hopefully we're on the other side of this and we never have to experience this again. But it really was a chance for us to take the few good things out of COVID and cement them into our practice long term. We can serve you anywhere, basically almost any time, long term. We're there for you.
I totally agree. And I do think that has been a game changer. We have a lot of patients that aren't very local, that are from out of state and from afar in the state, and being able to contact us and to communicate with us through telehealth has been very important. And I think it's going to be a part of our practice moving forward. Well, as you can tell from having us talk, that we're kind of passionate about our job. Dr. Velasquez, I'm going to call you back in and say, what do you think is the most rewarding part of your job? Because there's a whole lot that we can be excited about when you do weight loss management.
Absolutely. I echo that. There's a lot to be excited. But, I think that the biggest reward for me is to be part of the patient's journey, to be allowed to take on that battle against obesity and celebrate with them each milestone that they achieve. And even, be part of those moments in which they fall off the wagon and there's some weight gain and they come back and we battle together to get them back on track and celebrate becoming healthier.
I think that's an important part of this. There's the chronicity of this disease. We don't give up. We come back and we battle right with that patient. So, a lot of my patients will say they don't want to come see me if they've lost weight. I say that's when I need to see you. So, exactly. Well, Stephanie, how are you doing today?
I'm good.
I think we should give you a chance to talk to us. It's good to see you.
You too.
So tell us a little bit of background. Tell us how weight was impacting your life before surgery and what made you finally make the decision to do something about it.
First, I am so excited to be here. I wished I'd had something like this to go into when I made my decision, but I've been overweight since I can remember, since I was 7. So I was always a chubby child, never could lose weight, have been on every diet back in when Richard Simmons did his cards, to any kind of fad diet, any pills, anything I could do. I tried to lose weight and I wasn't successful, really ever. Losing that 20 pounds wasn't really enough for me because you gain it all back. But my life before surgery was pretty much nil. I was the epitome of a couch potato. And one day I was looking online, being on the couch, and I came across Longstreet Clinic and was like, I'm going to do this. I am absolutely going to do it. So I did a lot of research. I interviewed several other surgeons and surgeon places, but stuck with Longstreet the minute I walked in. So that's what made me do it. I was tired of being on the couch.
I think that interview part is clear, clearly important. I certainly think that this is the type of relationship that a patient and a doctor has that is not something that's going to last 20 minutes or half an hour. We're in this for the long haul. And so you want to be comfortable with the practice and the surgeon and the relationship. Mm-hmm. So tell us about your goal. Have you reached your goal yet? How much weight have you lost? What's going on?
I started at 217 and my goal was 50 pounds. And I've lost 72 now. So I went right past my goal. I was actually fine at 50, but 72 feels good too. And that's where I am. And, I don't think I'm losing, as fast as I was, but I know I definitely could if I wanted to.
Okay. So what are the difficult parts? Has anything been pretty rough for you? Has it all been easy? Tell us about it.
I think 95% has been easy. I had a great surgeon, Dr. Richard. I had a great time. I didn't have to stay in the hospital overnight. I'm an overachiever and wanted to leave that day, and I did, and I was absolutely fine. I did struggle. The only downside to anything was the constipation. So if I could say anything to anybody, get all that fixed before you have surgery. That was my fault. And so I'd had a little constipation after, and that was pretty painful. But other than that, I've literally sailed through all of this. I'm a teacher, so I was off 5 days of school. That was it. It was fairly painless and easy for me.
So wait a minute, you were a gastric bypass and you went home the same day?
I did. Yeah,
Okay.
you had to give me my bear later.
Just thought I have to bring that back up again, okay?
Yeah, I was ready to go. I was good. I woke up from anesthesia great. I was feeling fine. I went on home that night.
So how's your life been different at school?
Oh gosh, so different. I work at a school that has about 3,200 students. I used to teach Spanish and now I'm the tech coordinator. So my job is mostly running around the school, helping everybody all the time. I got a building that has 3 stories to it. 2 buildings have 2 stories to it. So I am up and down stairs all the time. And the difference is amazing now. I don't stop. I don't huff and puff. At part of the 8 stairs up, I am going up and down and like all the time. It is the energy, the excitement I have is just, it's beyond whatever I've felt in my life before.
So how has this weight loss been perceived by other students or coworkers?
Amazing. They tell me I'm too skinny. And I like to say this just because I think people out there want to know. I was in a size 16, 18, and now I'm in a 4-6. That was important for me to know where people were. And that's amazing. They tell me I'm too skinny. They tell me to stop losing weight. But most importantly, they know my affect is different and they know how happy and proud I am of myself.
It sounds like you're pretty happy that you've started this journey. So what would your advice be to somebody who's on the fence about the next steps in their journey?
Just do it. You've got these great surgeons in front of you right here. Like they said before, they've got a great staff. I used to call all the time. Nobody cared that I called 5,000 times to ask questions. I think you just need to go ahead and get a consult. You're not going to know until you do it. One day you might feel like, no, I can't have this surgery. It's too big of a surgery. It's not. It wasn't for me. I'm going to speak from my experience, and it wasn't any different than me having my appendix out or I had a hysterectomy, and this was much easier than a hysterectomy. So I don't know. It's just, I just think you need to have a consultation. That will have a lot to do with what your decision is, but you got to go talk to them. You have to.
I totally agree. There's no downside to spending time talking to one of us. So Stephanie, is there anything else that you'd like to share that I've not touched on?
I can't be any happier that I did this. Again, there's not been one day that I've gone that I regret. I don't regret it at all. I just want to thank you guys. I'm going to get emotional because this is how important this was to me. I was on high cholesterol medicine, high blood pressure medicine, antidepressants. I'm not on anything now. And for me, that is amazing accomplishment. I walk 2 miles without fail every day. I am a competitive pickleball player. If you don't know what pickleball is, you need to figure what that is because it's an amazing sport. These are things I've never been able to do in my entire life. And I just cannot thank you guys enough for literally saving my life and changing my life. Because being on that couch, as that couch potato, there was a lot of depression going on. And it had to do with the way I felt about myself with that extra weight. So I just can't say enough thank yous for what you did for me.
Well, you can definitely see why we come to work every day.
That's right. That's right.
So Stephanie, I understand, like myself, you're fluent in Spanish. Would you mind sharing a brief summary of your story as well in Spanish? ¿Podrías compartir con nosotros tu historia en español, por favor?
Claro, es que me llamo Stephanie, he perdido como 71, 72 libras en un año. Y esto ha cambiado mi vida completamente. Es que hago ejercicio todos los días sin falta. Como bien y es una vida diferente. Es una vida en que en mí misma me siento completamente relajada. Y antes no era así. Entonces, esta cirugía me ha cambiado para siempre la vida.
Gracias.
De nada.
So I'm the only one who didn't understand all of that on the call. So I understand that was over. Thank you again, Stephanie, for being here. You're doing wonderful as a patient, and I can't wait to see you again for our next visit.
That's right. Me either.
Well, guys, thank you so much, Dr. Del Monto, Dr. Velasquez, and Stephanie for joining us to answer these questions today. Do you guys have any final thoughts before we sign off?
No, thank you for having us. This has been great. I look forward to getting busy with the practice and continue to help patients.
Thank you, Dr. Richard. Thank you, Ms. Cloward, Dr. Velasquez. My advice to patients is, like Stephanie said, a chance to come in and see a physician. It's not a commandment to go to the operating room. It's a chance to consider your options. It's a way of hearing what is available, what options are, to have your questions answered. And then one really important thing, the scale measures your weight. It never measures your worth. So please recognize that you are a special person. You were made great. You're called to be awesome. If we can assist you in that, if we can serve you in that, we'd be honored to. Thank you so much for listening to us today.
And
Well,
I
so-
just want to let everybody know that this literally has changed my life. I know I've said that before, but I can't emphasize it enough. Going in, seeing everybody, talking to everybody, and having the surgery has literally changed every aspect of my life for the better.
Well said, everyone. You know, as a bariatric surgeon, we absolutely love what we do. It's not always the easiest job to have. We have patients that are pretty sick. We have patients that are pretty old. We have patients with a lot of medical problems. I think at one point, we were told that our patients were the sickest group of patients in the hospital. Yet our patients tend to go home the same day or the next day because we do a really good job of preparing our patients for this. As a bariatric surgeon, I can tell you when we see that patient for the first time, what we're thinking of is what that patient's going to look like and what that patient's life is going to be in a year. And that's what makes us do this over and over again, because we know we're going to be very impactful surgeons on these patients. And we're going to have patients that we're going to see for the rest of their lives, as long as, or at least the rest of our practice, because we think of this as a long-term commitment. I think you can tell we love what we do. We're here to help you all succeed in weight loss. So remember, our care is available here in Gainesville, in Brazelton, and Suwanee. We have 3 office locations. Feel free to like, comment, and share this post if you found this information useful to you or feel it will be helpful to your friends or family. If you have any questions at all that we didn't answer today or that may come up in the future, please call our office at 770-534-0110. And thanks once again for tuning in.